Dear student, today I am going to explain the details in pharmacokinetics. I already have told in last classes that from today I will discuss in details of every step what is involved in pharmacokinetics. So we already discussed that pharmacokinetics is of four processes. First is drug absorption, then drug distribution, then drug metabolism, then drug excretion. For food also the same thing is going on in our body. So today in detail I will discuss in absorption. So today we will discuss the first process of pharmacokinetic, that is absorption. This is very now from today I will discuss every step: absorption, distribution, metabolism, excretion, and all the topics are very big larger topics. So I am planning to organize all the classes in two parts. So today I will discuss in absorption part, and in between the two part today will be absorption part 1 that I will go to explain in that video, and next video I will cover the remaining topics of absorption. So for before studying absorption we have to know what is absorption. Absorption is a process by which the drug is got administered and got absorbed by our different part of body. That means last time we already discussed that different part of routes of drug administration. So after administration of ड्रग को एडमिनिस्टर करने के बाद कैसे वो बॉडी में इंजेक्ट करने के बाद कैसे बॉडी उसको एब्जॉर्ब कर रहा है, कैसे बॉडी में डिफरेंट मेम्ब्रेन और मेम्ब्रेन के अंदर होते हुए ड्रग कैसे बॉडी के डिफरेंट पार्ट में पहुंच रहे हैं या मेटाबॉलिज्म या डिस्ट्रीब्यूशन में जा रहा है, उस प्रोसेस को हम लोग बोलते हैं एब्जॉर्प्शन. So first going into the details we have to know how that absorption takes place for drugs and food. So that absorption of drug in our body is going through different steps or different processes and different methods. So these methods are classified into different parts. First one is transcellular. Second one is paracellular or intracellular, intercellular, trans or intracellular, and the last one is vesicular. Absorption. So now you may question me what is trans, what is para, and what is vesicular absorption. So first thing is trans or intra. Intra means we know intranational and international. Intranational means in nation different states. Like in India, intranational means in India different states. Like that, in cell different epithelium cells are there. In between how that drug is crossing the membrane, that is called intra or transcellular transfer. Now intercellular. What is intercellular? We know international means in the world. Means different countries are there. International trip means India to Australia or India to America, India to England, and intra means in India different states. Like I am staying in West Bengal to I am going to Maharashtra, Assam, all different states. That is intra. Like that same intercell. Here the drug is absorbed into the cell, what is called as GI epithelial, but in para or intercellular that is going through in between two cells. That process is called as para or intercellular. And vesicular absorption means in different cell, different vesicles are there. By how that vesicle the drug is got absorbed, that process is known as vesicular absorption. But the main part is trans or paracellular. In that also transcellular is more important because most of the drug, almost 90% of our drug what we are going to take is absorbed by that transcellular or intracellular absorption. So now I am going to explain transcellular or intracellular, because I already told you that whatever processes there, transcellular, intracellular or intercellular or vesicular, in between transcellular or intracellular is most important, because whatever drug we are taking, most of the drug, almost 90% drug got absorbed by that trans mechanism. In that trans mechanism, different steps or different processes are there. First is passive diffusion. Second one is active diffusion. So in passive diffusion also 4 different steps are there. First one is passive diffusion. Second one is ion channel, ion exchange. Third one is mediated. And fourth one is port transport. In active also 2 parts are there, or 2 methods are there. First is primary. Second one is secondary. In secondary also defined parts are there, that I will discuss when I will go in details about active transport mechanism of transcellular absorption. So before starting, we have to know what is the difference between active absorption and passive absorption. So active absorption and passive absorption. First we have to know for absorption how the drug is crossing the membrane. We are supposing that is epithelial membrane. That is membrane we are thinking. So let's suppose here the drug concentration is C1 and the drug concentration is C2, where C2 is greater than C1. So here that concentration difference will create, that will call concentration gradient, and according to that concentration gradient that drug will absorb and drug will go. Drug can be towards the concentration gradient, towards the drug concentration gradient, or it can be against concentration gradient. So according to that they are divided into 2 parts, active and passive. So we will know now what is active and what is passive. In active, the drug is generally absorbed against concentration gradient, So to that drive the drug, or to absorb the drug against concentration gradient, we have to put extra energy from outside. So we need high energy. For the drug absorption. But in case of passive, the drug is got absorbed towards the concentration gradient. So it is very easy to flow or easy to absorb. So for air, no requirement of energy. Energy is not required. So in active, energy is required because in that drug is going from against concentration gradient, and in passive it is going towards the concentration gradient. So in active energy is required, in passive energy is not required. The first thing we will discuss is that is passive diffusion, because through that passive diffusion most of the drug got absorbed. So first we will discuss this passive. In passive also I told you different steps are there. Passive diffusion, ion channel diffusion, then port transport, then mediated or cell mediated transport. So first we will discuss about passive diffusion. In passive diffusion, what generally happens, that GI endothelium cells are there. Here concentration gradient is created, and towards that concentration gradient the drug will get absorbed, and here we are absorbing the drug from concentration gradient towards concentration gradient. So here is no requirement of ATP or energy. So here the drug will drive towards that passive diffusion, towards the concentration gradient. But in our body, most of the drug, almost 90% of drug is passive diffuse. So there is not specific example, because most of the drug is going through that passive diffusion absorption. Then the second, in passive diffusion only, the next process is port transport. We know pore means little holes or little pores. In endothelium cells, little pores are there. By that pores, only drugs which are having less molecular weight, they can only pass. We only know the drug who have molecular weight of less than 100 Dalton can easily pass through that small membrane. In that, generally lipophilic drugs got absorbed. Yeah, only lipophilic drugs cannot be lipophilic drug cannot be absorbed. Only hydrophilic or aqueous can absorb because they have low molecular weight and they can easily pass through that pores. And here is also going towards concentration gradient, so no requirement of energy. By that, generally hydrophilic drugs which are loving or soluble to water, they generally pass through that pore absorption method, like different like urea, water, glucose, all that which are soluble in hydrophil or aqueous or water, they can easily pass through that pore transport mechanism absorption. The third and last one in pore transport, that is, or in passive diffusion, that is ion. That is ion exchange. In that, what happens? In that, the drug which are generally ionized drug or which are getting ionized when we are taking into our body, like different drugs are there, like benzalkonium sodium, benzalkonium sodium or benzalkonium chloride. When they are going to administer into the body, after reaching into the body in GI fluid, they are activating in ion and creating different ion like benzalkonium ion. For that ion to exchange, that type of mechanism takes place, and for that only ion exchange diffusion is come into the part. So in that, the ionized drug got absorbed like benzalkonium sodium, benzalchlorium chloride, sulfonic acid. They have low partition coefficient, then also they can easily absorb because they are ionized, and ionized drug can easily absorb through the different small pores or different channel present in the endoepithelial GI epithelial cell. Different examples are propanolol. We'll discuss all that drug later. Propanolol, you just remember, that is an example of antihypertensive drug. So by that I already covered passive diffusion. But in passive diffusion absorption, we have to remember that absorption of drug by passive diffusion is depend upon some laws or depend upon some factors that already discussed by a scientist called Flick, and he gave some law also to understand that factors which are affecting that absorption process. So by that Flick's law, we can know the absorption of drug, which factors that absorption is going to be affected by. What Flick law till? According to Flick law, dq by dt is equal to dak by h into C1 minus C2. I have already discussed that drug absorption in passive diffusion is always towards concentration gradient, and concentration gradient is the drive force which is actively sending the drug into the absorption process. So the driving process is concentration gradient. I already discussed, towards the concentration gradient drug is absorbed in passive on, so there is no requirement of ATP or energy. So that first factor is concentration gradient, that can be denoted by C1 by C2. dq by dt, that is the rate of absorption. We know what is rate. Rate means the amount of drug that is absorbed in our body in per second. So per time, how the drug is going absorbed, that rate is called is absorption rate, and that is denoted by dt by dq. And that d is diameter of that membrane. That diameter is how much thick it is. Then A is absorption constant, K is normal constant because that is directly proportional, so we have to use A constant. We already know A is absorption constant and H is the height or diameter, and then D is diffusion constant. Diffusion constant, because we are studying diffusion method. Here D is diffusion constant. A is total area or total area present in a epithelial cell. We are thinking that is GI epithelial cell. So what is the total area? That is denoted by A. and K is, I already told, that is proportional constant, because here is directly proportional. To give it equal, we have to use that constant, and 8 is the diameter of that frame or diameter of the membrane, how thick it is. Depending upon that also absorption is going to affected by, and C1 C2 is the concentration gradient. That means absorption is directly proportional to the diffusion constant, directly proportional to the area of membrane. This is directly proportional to the concentration gradient. That means if it is increasing, that means the drug absorption rate also will increase. And if it indirectly proportional to diameter of the cell membrane, that means the membrane, if it is more thick or diameter is more, then absorption rate is less. And if that is thin, that means diameter is less, that means rate is more. So that is the thing what we have to remember after passive diffusion of drug absorption. So the next topic is active, or the process in which energy is required, because that in that drug is absorbed against the concentration gradient. That is also a separate part, that active diffusion, then the intracellular and the vesicular transport of drug absorption. All that I am going to cover into the next part of absorption. Thank you.